Hi, my name is Jordan Frankenberger, and I'm going to be doing a health assessment on this young man. Right now we're going to be doing the nose, mouth, and throat. I'm going to put on my gloves for infection reasons. The first thing I'm going to do is I'm going to inspect the external nose for symmetry. I'm going to palpitate it and make sure that it's not tender at all. No any deformities or lesions. Is that sore or tender?
No.
Okay. Now I'm going to take a nasal speculum, or my replacement for a nasal speculum since I don't have one, and assess the inside of the nose. I'm going to note the color and integrity of the nasal mucosa. It's pink, no lesions noted. I'm going to check the septum, note any deviations from the normal. And I'm going to check the turbinates. I'm going to check the color, note any swelling or polyps. Everything looks normal. Now we're going to check the sinuses. We're going to palpitate right above the eyes. We're going to check the frontal sinus. Notice any soreness or tenderness when I do this. We're also going to check the maxillary right below this bone here. Notice any swelling or tenderness noted. Does that hurt at all when I apply pressure?
No.
Okay. Now we're going to inspect the inside of the mouth. We're going to check his lips, check the color, note any lesions, cracks, and the moisture. Okay, we're going to inspect the teeth. Notice any decayed or missing teeth at all. We're going to check the gums for color, swelling, or bleeding. The gums are pink, no swelling noted, no bleeding noted. We're going to check the tongue for color, moisture, and make sure it's intact. If you can raise your tongue to the top of your mouth, notice the moisture, make sure that there's no excess saliva or decrease in saliva. We're going to also note the buccal mucosa. So we're going to check the inside here. Note any lesions. Stop.
Keep going.
Okay, we're also going to look at his vulva and note the integrity and mobility of it. So open up. I'm going to have you say "ah."
Oh.
I note that it raised, so that's normal. We're going to check his tonsils.
Oh.
You're ruining it. We're going to grade his tonsils. I'm going to grade them as a 1, noting that they're visible. Then we're going to check the pharyngeal wall. Notice that it's pink, normal, and unswollen. No lesions noted. We're going to palpitate the tongue on the top and the sides. Note that everything's normal, no lesions noted. Color's pink. Check Stinson's duct when we palpitate the buccal mucosa. Note that there isn't one present. And that's it for this assessment. Hi, this is Jordan Frankenberger. I'm here and we're doing a skin assessment on my patient. With a skin assessment, it's important to ask your patient to undress. That way you can assess all areas of the skin. The first thing with a skin assessment is you'll want to note the color. Is there any hypopigmentation? No, any color changes whatsoever on any part of the body. His skin is normal throughout, looks fine. You'll want to assess the temperature of the skin. Is it warm or cold? His skin feels warm. You'll want to note the moisture. Is the skin dry? Do they feel like they're sweating, diaphoretic at all? His skin feels dry. You'll want to assess the turgor. You can do it on the back of the hand or up here. You just pull back on the skin and release it. His skin turgor was brisk, so he's not dehydrated at all. You'll want to note any edema note it. You'll note that in hands, arms, legs, and feet usually. You can assess by just pressing and looking. No edema note it anywhere. You'll want to assess for bruises as well, or any bruises anywhere. You'll want to know any scratches, any skin breakdown, anywhere. Those are all important things to look for. You'll also want to note the hygiene of the patient. Make sure that they're taking good care of their skin. You'll also need to know if you find any lesions. If you do assess any lesions, you'll want to look at the color, shape, size, and location of those lesions. Assessing his skin, I don't know any lesions anywhere. It's also important to look at the nails. The nails can be a very good indicator of skin condition. You want to note the shape and contour of the nails. You'll want to note consistency and the color. You can also check capillary refill. This tells a lot about a person's circulation. His capillary refill on all his fingers is less than 3 seconds, so he has good circulation. And note if there's any clubbing of the nails. Clubbing can mean that they're oxygen deprived. No note in any clubbing of the fingernails. That all looks normal. You can sometimes see it on the finger or on the toenails as well. And it's also important to teach your patient a skin assessment and how to do that at home. You need to tell them to undress completely, and you want to get in front of the mirror and look at the front of your body in the mirror to note any different, anything different like I discussed. You want to note the sides of their arms, and then look in the back, note anything in the back. Remind them that they'll want to look between their fingers and the inside of their toes. And then any areas that are hard to reach, you can have a family member look at those as well. It's also good to have a hand mirror in order to inspect the top of your scalp. You'll need to know any of that. That's always important to look at. Meaning that there could be some type of moles or anything along those lines in the hair. You also, since we're talking about hair right now, I'm going to go over his hair because I forgot to assess that. But you'll want to note the consistency, the color. You also want to know texture. All these are good signs and indicators of how someone's nutrition is. His consistency is pretty much the same throughout. Color is fine. Texture is fine. So, more than likely his nutrition is adequate. I think that's pretty much it for the skin assessment. Hi, this is Jordan Frankenberger. I'm getting ready to do assessment on the head, face, neck, and lymph nodes. With this assessment, you'll want to start out palpitating the skull. You'll want to check the general size and contour, know any deformities, lumps, or tenderness. Everything should be smooth. Fontanelles should be together when you're assessing an older person. Nothing bulging out or anything along those lines. You'll also want to check the temporal artery and palpitate that. That's usually along these lines, right above the occipital bone across from the ear. Okay, I feel it on this side. Feels normal. Feel it on this side as well. You'll also want to check the temporal mandibular joint. You assess this in the same region, just a little bit below. You have the patient open and close their mouth. And the movement should be smooth and you don't feel like any popping or cracking or anything along those lines. Feels normal. You'll also want to inspect the face for symmetry. Note the expression. Make sure it's normal and matches the particular situation. Symmetry of movement, so you'll want to make sure that there's symmetry on both sides. So ask them to smile. Note that it's the same on both sides, no drooping whatsoever. This is your cranial nerve. Note that that's normal. It's symmetry on both sides for him. And note any involuntary movement, edema or lesions. So none of that is noted on the face. You'll want to palpitate the neck. Make sure that it's symmetrical. Then you'll want to check range of motion of the neck. You'll do this by asking your patient to move his chin to his chest. Okay. Then you'll want to have him move from side to side, like you're shaking your head. Okay, ear to shoulder.
Oh my goodness.
And then the head towards the back. You want to note that they're smooth. The movement is smooth and controlled. No cracking or popping noted. And then for lymph nodes, the main thing you want to assess here is any tenderness noted, which can be infection along those lines. You'll want to check preocular, posterior ocular, occipital, jugulo, gastric, supramandibular, supramental, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Okay, so let's just check here. We'll palpitate here. We're going to palpitate around here. 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 I want to come around here and check here. You want to do it on both sides as well, bilaterally. Any tenderness along those areas? No swelling noted either. We'll also want to palpitate the thyroid gland. You'll want to note any enlargement, which could indicate a bruit. And you'll also want to assess the position of the trachea. Make sure it's midline and not deviated to the right or left. Everything looks normal. That's it.